So they could ask, like, can you please tell me about a time where you had to give constructive feedback to a coworker? Or can you please tell me about a time when you had to help a coworker be more effective at their job? How would you
Mhm.
handle a conflict with a coworker?
Mhm. Um, so I think it was one of the nights when it was the short staff night where it was my classmate and me and a bunch of the CNAs and the nurses, but we're short staffs because there are a lot of patients. One of the CNAs was taking his time with his vitals. He was having conversations with all the patients, but like at a rate that it was just ridiculously like slow and like not effective at all. And I know he was trying to like just make small talk with his patients, but I feel like he wasn't seeing the bigger picture of we needed to get these vital signs charted. We needed to get everything done, in a swift, efficient way. So after getting my like vitals done and seeing him still kind of slack off on his, took him away from the patient's room and into the break room, and I kind of told him, I know you're. I try to be understanding. Like I know you're trying to, make small talk with your patients, but we're really short. Like a reminder that like we're short staffed tonight, and we need for you to be more efficient if that's possible. After you finish with your job, you can come back and make small talk, but it's important to just finish the tasks at hand first. I would say something along those lines for that story.
What kind of environment are you looking for that will challenge you and encourage your engagement? Another question that's super similar is what support do you think you will need from your preceptor?
Okay. Um, I think I would say uh, is it for the so I think I'm a little confused because the environment question, is it like what type of like environment, as in like your coworkers, and is it that type of environment they're asking for, or is it more like, does that make sense?
You like work environment versus like learning environment?
Yeah.
You
Is
could
it
address
more
both.
work or
So you could talk about how you'll really want
uh
support in like learning what your resources are so that you can get familiar with the policies and procedures so that um, it'll help you make sure your patients have the best outcomes that you can give them and when you're trying to keep them safe. You know what I mean by
okay.
that? Where like they have like an official
Yeah.
policy of like, this is how you put in an NG tube. You do this first, that first.
Yeah.
These are the supplies you use, whatever.
Mhm.
Um, Another thing people talk about is like what kind of like characteristics they're hoping for in their preceptor.
Okay. I was thinking like for the environment one, I was gonna say like an environment that has a strong foundation of like teamwork and not like being like a team player for everybody. And if you're new, just of course utilizing your resources, but for everyone to be helpful, like understanding that you're new and everything, and um, something along the line of um, like basically just always being willing to help. I guess I would say.
Make it sound like you definitely want that to be a two-way street, that like you would love
Okay.
to like form really good relationships with your coworkers in the sense that it's just sort of understood that you check in on each other and like
Okay.
help
Got
each
it.
other, like if they have a heavier assignment that day, you help them and vice versa.
Mhm. Okay. Got it.
Yeah.
I see what you mean.
And then what, like talk about like what you want in turn, maybe talk a little bit more about like wanting to know what your resources are, or like the
Okay.
policies and procedures. How would you talk like a sentence or two about that?
I would say being in a hospital where the team follows like the policies and procedures, but are like keeping an open mind. In wait, I'm sorry. What was the question again?
Like they could ask like, what do you think you'll need the most help with from your preceptor, or like what kind of environment are you looking for that'll foster your growth, or um
Hmm.
like most hospitals have policies and procedures, so it'll just be like um you could talk about like wanting to know wanting help familiarizing yourself with like the hospital specific resources, like how to look up where the policies are, and like
Oh, okay.
how do you reach out to like rapid, or like how do you call a code
Mhm.
stroke, like how to navigate within that specific hospital system.
Mhm.
You could talk about like wanting that kind of pointers from like workflow type pointers from people.
Okay. Okay. And I think for the preceptor one, I was gonna say something along the lines of like we have like open communication and a level where I can like receive constructive feedback, you know?
Love that.
And
Yes.
okay, I was thinking along those lines too, because I
Because
feel like the environment, yeah.
there's like there was like a big movement of like we really need to work on bullying, like nurses eat their young, whatever.
Yeah.
But now there's also like an additional counter movement of like young people can't take feedback anymore.
Mhm.
Like their instructor tells them you're not doing this safely, and they're like, why is she always criticizing me? Why is she treating me this way? And it's
Yeah.
like, no, I'm trying to help you. So
Yeah.
like people love when new grads like want the feedback, like when they're down and they're
Mhm.
like, tell me all you got, because like you're helping me,
Yeah.
yeah.
Yeah. There's open communication and honesty with my performance.
Yeah. Yeah.
Okay.
No, like 100%. That's really refreshing to hear. They're going to
Okay.
love that.
Thank you.
Yeah.
Got it.
Yeah. If they ask you, would you prefer day shift or night shift? What would you say?
Um, since I'm starting out, I don't really have a preference. I feel like the end goal is for me just to get experience, whether it's days or nights. And if I really had a preference, I think I would choose days. But at the end of the day, it doesn't. It's not going to affect me at all, no matter which one it would be.
Beautiful. That helps. Like, let's say the emergency department manager like really likes you, but
Mhm.
like their only position is night shift, and you say you want days. They'll be
Yeah.
like, damn, but he's not going to be happy because he said he wants days, so I should give him to a manager that needs a day shift. But like, what if there was no day shift manager that really like, you know what I
Yep.
mean? Like, it helps
Yeah.
you. At the end they usually say, that's all the questions that we have for you. What questions do you have for us?
I think one of the questions I would ask is after like the new grad program, say if I'm not or someone is like not progressing enough, will we be given extra time or how would that look like if we needed extra help, I would say?
I would not ask that. So the answer,
No.
like
Okay.
real life, the answer to your question is like your manager should be checking in with you,
Okay.
and they'll ask you and they'll ask your preceptor like, do you feel ready to be on your own next week?
Mm.
It's kind
Yeah.
of like what you report and also your preceptors, and then your manager will go off that. It's more expensive for them to pay for you and another nurse along with
Hmm.
you. It's like two people's salary for like one person's job
Hmm.
essentially. So they don't like to keep you on longer than they have to with a preceptor. um
Oh, okay.
I feel like a better question would be, um can you tell me a little bit about what the orientation process looks like?
Okay.
Because you don't want to have it in their head that like you're already the person that's trying to be more expensive.
Yeah.
You know what I mean?
Got it. That makes more sense. I didn't look at it from that aspect.
Yeah. What else would you like to ask them?
Is it fair to ask the nurse patient ratio?
You could. I can just tell you it's going to
Yeah.
be, it'll kind of depend where you float. If you do float pool, like ICU will be like one or two patients per nurse.
Hmm.
Med surge is always like 4 or 5 to 1.
Hmm.
um Step down's usually 3 or 4 to 1, depending on if they're like on cardiac monitoring and stuff.
Okay.
Yeah.
Got it.
um
I feel like I had more questions, but
so questions that get them talking is like, if I were to get the position, what advice do you have in the meantime that would help me prepare?
okay.
You can ask
That's
that. You can ask them
good.
like, can you tell me about the goals that you're working towards on the unit right now? And they might be
Okay.
like, what are you talking about? And you could be um like reducing infections or like reducing harm events. Is there anything that you guys are working on right now? and they might be
Okay.
like, they might just go off talking about like all this stuff.
Okay.
um
Got it.
so with all three of these questions, you can like listen to what they say, listen to the parts that like sound really good to you, and then mention that in
Mhm.
your thank you letter afterwards, your thank you email.
Okay. Yeah.
Like, because what most people do is they'll do a thank you note that's like, thanks for meeting with me. They list
Hmm.
like 3 reasons why they are the most amazing candidate, and then they say thank you. But if you like thank them for meeting with you, and then like it was so great to hear about like whatever they shared with you, and then like
Hmm.
I would love to work in a hospital that values these things X, Y, and Z, because that's always been really important to me as I develop as a nurse, whatever.
Got it.
It's like, oh yeah, we did talk about that. Like,
Yeah.
yeah, yeah, like connected with that guy. That guy, like he listens. It's like
Mhm.
an opportunity to like really solidify a connection with them.
Okay.
And then when they're crossing off their list, like who are we going to take? Like we have so many great people. Who are we? They're not going to want to cross off the person that they like connected with. You know what I mean?
Yeah. Makes sense. Got it.
So
I've
it's
never
just
heard
kind of
that.
like another
Okay.
opportunity.
Got it.
Yeah. If you miss it, it's not like a game killer, or what, like it's not like a deal breaker, but it's like a missed opportunity if you don't do it.
Got it.
Dude, we've legit gone through all the questions I had.
I would say, okay, first, I think first, if I had communication with them, say if I had their number for work reasons or anything, I would ask and check, like, are they doing okay, or if they're on the way, or if they're running late, or traffic. Check up on them first just to get an update so I can gauge whether or not, like, it's safe for me to leave or not, because I'm not going to leave until my shift comes. And I would say something along the lines of, I would just be willing to wait because even though I'll be like, even though my shift replacement is coming late to their shift and I'm going like technically overtime, I'd just be willing to stay and make sure my patients are all safe and the unit is running smoothly.
You're like 80% of the way there. So
Okay.
you would never leave until you've like given handoff. So like even if they'll be there in 10 minutes, you still don't leave until they get there. You know what I mean?
Okay. Yeah.
So at that point, if they like check in on them, make sure they're safe, just tell them like just get here safely.
Yeah.
We'll take care of your patients, don't worry about it. Things happen.
Mhm.
And then talk to your charge nurse and let them know what's going on. Offer
Okay.
to stay. Um, and it's possible that they might say, um, I know this patient, I can give report, you go ahead and go home. So I would,
Yeah.
I would check in with the charge nurse and see what they feel like is most appropriate. And
Okay.
then I'll follow their recommendations. If they'd like me to stay, happy to do it. And then I actually had a girl say that she would like knowing that that nurse is going to start a little bit behind.
Hmm.
Um, I would, um, try to do anything that I could so that that nurse could feel a little bit more caught up on her work when she gets there,
Mm.
whether it's
Okay.
like just giving like a bed bath, or like,
Yeah.
making sure the patient isn't like in pain right when she starts, or like any little thing I
Okay.
can do to make sure that she's kind of able to catch up quickly when she
Got
gets
it.
there. Yeah, I think that's about it. That's kind of what they want to hear.
Okay. Okay.
Okay, so clinical. So you watch the video and you kind of get like the formula.
Yes, I think
Because the
so.
formula is kind of like armor of like, no matter what they ask, I can just throw out this like vague stuff and it'll fit.
I did have one question about the formula.
Yeah.
Would it be important? I guess it might depend on the situation, but is it more important to assess the patient first or call for help first?
Kind of both. It really
Both.
depends on the situation.
Okay.
So like generally, because I feel like people are like, oh gosh, what's the right answer? And they don't like
Yeah.
imagine themselves there. So like you
Yeah.
imagine yourself walking in and your thought is like, this is bad, but like how bad is it? Right? Like,
Yeah.
do they have a pulse? Okay, cool.
Mhm.
Can they like, are they awake and talking? Cool. Do they have vital signs and do they suck? Okay, we're good. Um, can they tell me what happened and like what
Mhm.
symptoms can they give me? Like I want more info. And like look at like if there's blood, where is it coming from? Like if the vomit, like what did it look like? Like did they injure themselves? Any of that stuff that they can tell you. And then, while you're doing that bit, you're maybe like sitting them up if it's like a respiratory thing. And like a lot of times while the blood pressure cuff is like, you want to say vitals like within the first few sentences. And you could say,
Okay.
while I am cycling a set of vitals, I would press the call button and ask for the charge nurse to come to bedside, and you can say anything that you'd want her to bring, like Zofran or like the EKG machine or whatever.
Okay.
And then, you could say like, if it's something super urgent, while I'm asking questions about any symptoms or what happened, I would ask that the charge nurse touch base with Rapid and see if they'd like to come to bedside or any recommendations that they have.
Okay.
And then kind of at the end of all of this, you would say like, and then I would reach out to the team and see, let them know what had happened and any changes, and then see if they'd like to do any other workup at this time. So if you're like really stumped and you want to go vague, like pulse, they can talk, vitals, get the charge nurse. Yeah. So I learned like the safe way to phrase it is I looped Rapid in just so they have this patient on their radar and know what's going on. Then they can't say that you like over or under escalated it.
Yeah.
And then if you have no idea what to say for like what labs or like imaging or whatever they might want, you can literally just say, I would reach out to the team and let them know what had happened, and then ask if they'd like any other workup at this time, maybe imaging or labs or whatever they would like to do. And that's super vague. You get the answer right, whether it was like a troponin or like electrolytes or like they wanted to give blood or like whatever it is, you covered bases by saying, I would let them know what happened and ask what other workup they wanted this time, like labs or imaging or anything like that.
Okay.
Cool. So you have that to use no matter what they ask you.
Got it. So if mine goes blank, just
keep it roll with all of that, keep it right, and you get like 80% of the answer right.
Okay.
Yeah. The other things are just kind of picturing yourself there and like, what info do you want to know? So what would you do if you walked into your patient's room and they had increased work of breathing and they had cyanosis?
If they had increased work of breathing and cyanosis, I would immediately call Rapid. I think that would be the first thing I would do, because even though I don't have a set of vitals based on their appearance and their presentation, I think it's a justified cause enough to call Rapid, let them know the situation. After that, I would get a set of vitals and perform any intervention. So if they're low on oxygen, I could get the nasal cannula and put that on the patient, in addition to calling the CNA immediately after, or not the CNA, the charge nurse, and let them know about the situation and any further equipment that I would need from the supply room if I needed that. On top of that, I would, I feel like I'm missing something. Well, for the vitals, I would mention, of course, like the pulse and everything. Get a blood sugar check just in case if they're hypoglycemic.
That seems a little odd. The blood sugar.
Oh, sorry. Never mind.
I'm thinking like, what's their respiration and like what's their oxygen saturation?
Got it.
Yeah.
And then after that, would I think? Would it be fair to say, like, could I check if they had any allergies or like check the MAR to see if they're allergic?
100%.
Okay, that's what I was thinking too. And trying to identify the cause, of course, after treating them and making sure they're back to baseline or back to their level of vital signs that are not abnormal. and then let the physician know that of the situation, and how the patient presented, their respirations, their depth. I would like auscultate and let them know like what I hear, and if there's any recommendations he would want me to do from there.
So I'm trying to remember all the things I wanted to add. So you could say that when you call rapid, that from what you understand,
Mm.
it's a nurse and an RT. So that way you're looping in the respiratory therapist like right away.
Yeah.
And then
Mhm.
you could talk about like sitting them up. I don't know if you said
Oh
that or
yeah,
I said
about
that.
that. No, I don't think I did.
And then you could talk about like if they are like already on 6 liters and they're not recovering, that you
Mhm.
put them on a non-rebreather.
Okay.
Um, and then when you're talking to the provider, oh, you could also ask like, do they have any pain?
Okay. Got it.
Um, and then for when you ask the provider, um, you could ask if they want like a blood gas or if they want a chest x-ray. Those are two things you
Okay.
could throw out
Okay.
because that's sort of like their wide net they cast for like respiratory things, chest
Got it.
x-ray and blood gas.
Okay.
Yeah. And that'll cover like VBG or ABG. You know what I mean?
Yeah.
Cool. All right. What would you do if you came into your patient's room? Or let's say, you were cleaning your patient and then all of a sudden
Mhm.
they started to have a seizure. What would you do? And you're in there like with the nursing assistant, let's say.
Immediately perform the assessment of turning them to their side so they don't aspirate. If they're on the bed, I would make sure it's flat and it's not at 30 degrees or anything. Depending if they're on the ground or on the bed, make sure the surface is flat and make sure that there's no item or no like objects that get in the way of the patient. If they're wearing anything that would be tight, with probably not because they're in the gown, but I would try to make sure like they're not tight in any of the areas of their clothing. On top of that, I would get the oxygen at hand and let the charge nurse know that of the situation. I say get a set of vitals and assess, or can I say like note the time of the seizure, or like try to
Both.
time it
Yeah.
and okay, time the seizure and like how the patient's presenting,
Try to get a set
and
of vitals too. Why not?
yeah, set of vitals with that. Immediately after that, say if they kind of return back to baseline or they're kind of back out of the seizure, make sure that, of course, their vitals are all back in the normal range, and call the physician, and let them know about the time of the seizure, the symptoms of it, and if they wanted to get like an MRI of the brain as a recommendation, for any electrical activity, and if they're on any anticonvulsants. So yeah.
So you could say I would call my nurse or I would call my charge nurse and ask her if she could bring any Ativan or any PRNs that might be
Okay.
available if this is something that has been ongoing and the patient might already have
Hmm.
an order. Um, but if it's the first time, they won't.
Yeah.
Usually what they want to do is they want to start EEG, which like the EEG techs come in and they glue all this stuff to their head and they like
Mm-hmm.
watch it for I don't know, however long.
Okay. Got it.
Um, yeah, and then describe the post-ictal period as
Okay.
well. See if they'd like any EEG or any PRNs just in case, like PRN Ativan, just in case there's another seizure in the future.
Okay.
Yeah. And then to make sure there's a fall alarm and like pad the bed rails and
Hmm.
make sure like you have suction set up going forward.
Okay.
Yeah.
Got it.
Yeah. Perfect. Okay. So what else? What would you do if you came in to your patient's room and the patient appeared to be asleep and you saw that they had vomited blood?
Um, I came to the patient's room and they're asleep and they vomited blood. I would immediately get a set of vitals on them, get their perform a neuro check and get a set of vitals. Check for a pulse first, um, and then call the charge nurse and let them know what happened. On top of that, depending on their vitals or if they're conscious or not, I can call rapid response or let them be in the loop of the situation. Um, After that, I would put the head of the bed up just so they're not don't choke on their own blood or anything, and call. Um, I'm missing something, but call a physician and let them know of the consistency of the blood, if it's how much or the estimate in milliliters and the consistency of it, if it's dark red or light red, or and probably check if they recently had a surgery because it could be sign of hemorrhage or anything if they're unstable or stable. Try to like gauge that. Um, and maybe get like let the doctor know and try recommend like maybe getting some fluids or some blood, maybe to get a transfusion if it's a lot of blood, anything along like that.
Okay. You could also ask if they have any abdominal pain, if they feel dizzy.
Mm-hmm.
And then in terms of what the doctor would recommend, I feel like the standard is they usually want a blood count. Like they want to see like the hemoglobin and hematocrit
Got
just
it.
to see like, maybe they transfuse if the hemoglobin is less than 7 or whatever. Like if they
Got it.
drop 3 points, like they're probably bleeding.
Mm-hmm.
So see if they want a blood count and coagulation studies.
Okay.
Um, and then they also usually like if they think there's a bleed, sometimes they want a CT.
Mm-hmm.
Um, but yeah, if you're like, and if you don't know, you could just say like if they want any labs or imaging,
Okay.
and that covers it.
Yeah.
You're
Got
really
it.
good at these.
Thank you. I
Yeah,
appreciate it.
it's
I've
like
been
boom,
studying
boom,
your
boom,
videos.
boom.
I've been looking at the videos
Okay,
and
cool.
trying to get a
Yeah,
good idea of it.
yeah, you're ready for these. General advice for you. I feel like you do a really good amount of like it sounds like you're like quick with your answers and they're like short. You don't ramble, which is good. You don't like
Thank you.
look uncertain at the end. You like
Mm-hmm.
end your sentence confidently. I love that. You don't sound like a robot. Um, you have like just the right amount of heart that comes through, you know what I mean? Where it's not
Okay.
like world peace, but like it
Yeah.
shows that you're like in this because you want like a fulfilling career and this means something
Yeah.
to you. Uh yeah, like don't change any of that.
Okay.
You're like at
Thank
the
you.
right amount of like all that stuff.
Okay. I
Yeah.
think sometimes during my interview, like after it, I'll like think to myself, like, oh, was that too robotic? But it's good to get the feedback that I'm
Yeah,
like
it's
on the
good.
right track for that. Thank you.
It's really hard to coach people out of that too. So I'm glad you're
Oh,
not
I
like that.
bet.
Um, the only thing is, and I like this is really important because if they're like,
Mhm.
we liked him, but I can't really picture him like I mean, you knock the ball out of the park with the clinical scenarios. So
Mhm.
I'd still pick you, but
Thank you.
um they're gonna want at least one, preferably two stories of
Mhm.
I was with a patient, this thing happened, I let the nurse know and I did these vitals and turns
Mhm.
out this was going on with the patient and whatever, you know what I mean?
Mhm.
Whether it's like, you know, you had to do a stroke workup or someone had chest pain or someone was having difficulty breathing or someone was septic or like any little thing where it was like this could go bad.
Okay.
You need to think of one to two things like that. Hit
Okay.
me up when you think of them and I can just like listen to how you tell it and let you know if it's good, but like for sure you need those. I think that's the only thing you're missing.
Got it. Okay. I could probably think of something like later tonight or like early tomorrow morning. I can email you.
You're gonna think of it at like 4 a.m. You'd be like,
Yeah. Watch, it's gonna come to me.
yeah. Okay, cool.
Okay.
All right. I feel really good about this.
Yeah. Thank
Hit
you.
me
I
up when you think
appreciate
of
the
those,
help.
okay?
Okay. I will, and I'll keep you updated too.
And
Thank you.
then it takes a while for this to upload into my Gmail, but I will send you these recordings tonight.
Okay, thank you. And I don't know if you need this for like YouTube or Instagram, but you're welcome to use it. Like
Thank
you helping
you.
me, so I'm to help you too. So it's all
Okay,
good.
cool. I think I need more videos of like guys. I feel like they're all girls.
Really?
So that helps.
Yeah.
Yeah. Thank you.
Yeah, feel free. Of course. Yeah, no worries.
Yeah. Thank you. All right.
All right. Thank
I'll
you.
talk to
Good
you when
night.
you think of your stories.
Yeah, sounds good. Thank you.